transgender expression. Jesus' work on earth focused on healing the sick and feeding people and listening to those who are on the margins. Since it was a main focus of his ministry, I feel it is reasonable to conclude that those are God's desires. In the present day, God makes those things, healing, community wellness, and pursuit of happiness possible through the miracles and mundanity of modern medicine. That miracle and mundanity saved me in November when I had a hysterectomy. I have 2 forms of insurance, and yet I'm still paying on that because I can't afford to pay the whole thing off at one time. So I did tell my kids the other day that we weren't going to McDonald's because I continue to have health care bills despite having insurance, and I'm pretty well-to-do in the community. So I think long and hard about the people who would not be able to have that surgery or would have that surgery and go into massive debt because of it, and not have minor inconvenient choices to make so that they could pay off a necessary medical procedure. So because of my experience and because of what I believe faithfully, access to health care, regular and emergency medicine and treatment is a moral issue. Denying people access to health care through cuts to Medicaid, Planned Parenthood, caps on lifetime coverage, or by any other means is an immoral act. Removing the social safety net of health care is not reform. It's a rejection of Alaskan values, where community and neighbors need support and survival. Senators Murkowski and Sullivan, we dare to demand that you stand up for Alaskans and reject any proposed health care legislation that leaves more than 100,000 of us without health care. Would you look us in the eye and tell us that Alaskans of lower income, that those of us who are disabled, our elders and our elderly, our children, or those struggling with addiction are not worthy of care? If you cannot look us in the eye and say these things, you cannot make a decision that says the very same thing in Washington, D.C. We expect better. We expect health care, and we expect health care coverage, and we demand it. Choosing to give us anything else is unacceptable, not only in the face of the Alaska and U.S. Constitution, but very likely unacceptable to an even higher power, your God and ours.